Hello again.
Hi, Adam.
All right. So we're going to shift gears now, and we're going to look at your internal medicine. Um, you're going to have multiple teachers teaching you internal medicine. We have 4 modules of internal medicine, and this is just the beginning. And what I thought I would do as your initial instructor, I think next week we have other conditions, and then we have other professors who will be offering internal medicine. What is internal medicine? Right? Internal medicine, this is basically looking at all pathologies that you're going to run into in a clinical setting, both Western and Eastern from TCM perspective, and understanding their etiologies, their presentations, and your core approach for differentially diagnosing them and also treating them. Okay. So that is the precept of internal medicine. It prepares you to actually do clinical practice, right? So in the presentation series, which you viewed and submitted most of the questions, I think there's one or two questions missing from, I don't remember who exactly. I checked the Edpuzzle, but I'll double check again. I think it's one of the open-ended questions. But what I'd like to do is, this is a flipped classroom. So just as an example of what you can expect in a flipped classroom, which is a little different than what you're generally used to in lecture series, is I'm not going to be lecturing. You're going to be talking. So I may ask you questions. For example, I may ask Zelda to explain okay, back up. In TCM, there are statements of truth. We call them statements of facts, right? It's important to know these statements of facts. Like, for example, wood represents the liver and the gallbladder. That is a statement of fact, right? And there are many, many short statement of facts that are very, very important for you to internalize, because they are the precepts of your diagnostic approach. So when you're trying to come up with a diagnostic reasoning for a patient's case, you always want to rely on statements of facts to help you guide your approach, right? So a question for you: in relation to blood, the wood element and the fire element, the heart and the liver, what is the relationship in relation of these two organs, or these two zangfu, in relation to blood? There is a statement of fact in relation to blood.
Liver spreads blood, and the heart, the blood resides in the heart.
Okay.
What
do you think? What do you think?
I don't know the word you used, but I would say stores, no? Liver stores blood. I think you said the opposite, and the heart circulation. I mean, how would we say that? I mean, is in charge of the circulation of blood, or the governance. Yeah. Okay.
So in the review, we looked at the relationship between liver and heart. Why is this significant? See, I want to give you an example of how this simple statement of fact is diagnostically relevant. If you have any issues with regulation of storage of blood, you're dealing with the liver. If you have issues with regards to circulation of blood, then you're dealing with the heart. Right? So in your presentation, in a symptomatology, ask yourself a question: is this symptom have to deal with storage, or does it have to deal with regulation of the circulation of it? That is why in a lot of menstrual conditions, difficulty menstruation, amenorrhea or dysmenorrhea, etc., you have both organs involved. Right? You have the liver that maybe is not storing properly and releasing properly. And then you also have the heart, which governs. And if you remember from your initial TCM theories, there's actually the bow meridian channel, internal channel, that connects the heart to the uterus. And through that, it governs the hormonal elements. Remember the fire and water, endocrine system, hormonal axes, right? The PTH axis is involved in regulating the hormonal So that's very important in understanding. That's why statement of facts are very, very important. For example, I'll ask you a question. Liver and the lung. Explain to me which direction their chi flows in the body.
Lung goes down. Liver is spread. I mean, it's no, but yeah, I don't remember. Down as well.
What do you think?
In terms of the one compared to the other,
Yeah, wood and metal elements.
Yeah.
Wood and metal elements. Always remember, right? So
Now
in a
we're right.
relationship between metal and wood, they are the pistons that govern the movement of the chi ji. You remember chi ji, the cyclical nature of the chi flow in the human body. One ascends, one descends. Lung qi must descend. Now, they both disperse. Lung qi disperses in the Tzu Li. Liver qi must flow freely to disperse across and to regulate TNT and other functions, right? But from a vectoral perspective, lung qi must descend. Why? Give me one example, either one of you.
To grasp the breathing, no? I mean, with the
Very
kidney.
good. For inspiration, kidney must be able to receive that lung qi in order to complete the inspiratory cycle, which means a lot of asthmatic conditions rely on those two organs, right? It's either the lung qi not descending properly, is revolting upwards. What is cough? Cough is basically a revolution of the qi in its opposite direction. Lung qi should normally descend. When it ascends, meaning it's revolving, or, revolting, it's going upwards, that's where you have cough, right? And then if the kidney qi is not unable to grasp that descending qi, then you have asthma. Then you have inspiratory asthma, right? So these statement of facts are important in terms of understanding the differential elements of these organ relationships as they relate to symptoms. I don't remember if you were in a class where I taught the foundations of differential diagnoses, but one of the first questions that I ask all my students is, what do you think a doctor is?
Detective, you have told us that.
It's a detective.
No? Yeah.
You're Sherlock Holmes. Exactly. And these statement of facts are giving you tools to look through clues, right? Because your patient is literally a walking clue. It's a bag of clues from the things they wear, from the way they walk, they talk, they smell, they breathe, the symptoms they present with, the history of the patient, all of that. It's all a bag of clues. What you need to be able to do is pick and choose and understand how these different clues create patterns. Because in TCM, we do pattern differentiation, which means if A and B and C, then it leads to D, right? So you create your logical diagnostic reasoning based on these patterns.
Some signs, some symptoms that we had in the case studies as well. I'm getting kind of confused as to, because sometimes could be yin deficiency, but it could be yang deficiency as well. And when does it differentiate the one from the other? Or for example, the chronic fatigue, for example, which is like very kidney disease. We know that for sure. Like we used to know it's kidney yin, although we saw now that the chronic is yang, but cases that are chronic are more yin than yang, because actually the fluids and everything has been severely depleted. And that's just an example. I have many.
Very good question. Now, what I'd like you to try to do as a collective here, as a group, is to try to see if we can answer that question ourselves. I'm going to step back now. Think about how would you answer that question, because there are two very important elements to what you just mentioned. and I'll give you the exact answers after I will give you the opportunity to express your views, your opinions of why, for example, you may have a bunch of symptoms and they present differently in different patients, or you may have conflicting symptoms in a patient. So go ahead, share your opinions.
Well, I mean, I've been going through the same on my end. When you put together, and actually the exercise has been very interesting on that, because when you were asking us to pull the words, some of them would appear on both possibilities, yin deficiency, yang deficiency. So what I've been trying to do on my own, walking my dog, actually, just thinking about it and say, well, how is that possible? So I was trying to explain also on the theory that you were telling us. For example, on the fatigue, I thought about that one specifically. It's like, okay, for me, the way I would, but then of course you need all the other pieces, as you were saying. I mean, to get to the conclusion at the end, that's not the only one that you will focus on, because it can be controversial, and with that, many others. You would try to put together the puzzle and then say, okay, then that fatigue is part of a yin deficiency or part of a yang deficiency, but all the other elements need to be put together. I mean, I don't know if, but that's, yeah.
What do you think? What is your thinking?
Actually, my thinking is fatigue has to do with generally movement and activity. So it means there is lack thereof. Therefore, it goes towards yang. Spleen, although, on the other hand, which is rare, if we have spleen yin deficiency, that is fatigue, brings fatigue. But on the cases as well of the chronic fatigue, for me, it's kidney yang deficiency. So that's where I'm ending my reasoning. But because it has to do with kidneys, which is both the root of yin and yang, but it's also store the essence. The essence is completely yin.
We're on the right track. Now, hold off. You guys, both of you are on the right track. Now, what I'm going to do is I'm going to give you guys, I'm going to ask you to step back. You're focusing a little bit too much at this point. Back away and look at the integrative, the holistic picture. Two facts. Fact number one, yin and yang are interchangeable, and yin and yang are interconsumable and interdependent. The key facts of yin and yang is that you can't have one without the other. So if you have a symptom that is presenting as a yin deficiency, oftentimes you will have concomitant elements that affects the other. Okay. Because yang function consumes yin. If you have a chronic state of yin deficiency, there's not going to be enough yin to consume to create yang. Therefore, you will have yang deficiency. You see the point? So that's fact number one. So look, especially in your diagnostic reasoning. This is why I wanted to start with yin and yang. All of your internal medicine classes, everything from bee pain to runny nose, look at the roots. And the first ever root of TCM foundations is yin and yang. So always try to, if you can answer absolutely nothing about that patient, try to get down to the yin and yang, because that'll give you the building blocks from where you can then move on, right? So that's the second important point. The third important point is the presence of incongruity. Because you're doing pattern differentiation and you're a detective, when you find clues 1, 2, 3, 4, 5 that are easily explainable and easily fit together, the real mystery and the ability to get to the real cause is to find that 1 or 2 clues that are incongruent, that don't belong, that don't fit, and find a way to fit them based on your knowledge and understanding of how they would fit. Because they are the hidden clues that will guide you to the true root symptom, to the true root pathology, right? So for example, You may have a patient that comes in with all the symptoms of spleen deficiency, spleen Qi deficiency. We know Qi is yang, so therefore spleen yang deficiency, TNT is impaired, all of that stuff is included in there. But then there is some small symptom that doesn't fit there, right? How do you account for that symptom that doesn't fit will determine how best you will approach it. Because a lot of the average practitioners will see an evening fatigue that's worse in the evening as just, okay, whatever, you know, it doesn't fit, whatever, right? But a proper diagnostician will look at it and say, well, wait a minute. Spleen is yang, yang is during the day. Why am I having evening fatigue, which is more predominant? What is the time of the evening? Yin. So therefore, this fatigue may have a root cause in the yin. Where is the yin, the source yin of all internal organs?
Kidneys.
Kidneys. So now, having that logic, I can then look through my patient's overall case again to try to identify other kidney insufficiency symptoms that either the patient overlooked or I overlooked. Because sometimes the patient may overlook them or may not think it's important to discuss with you. So that is why the actual intake, the actual process of talking to the patient also changes. It's not just answer 5 questions and 10 questions and 10 songs, tongue and pulse, I'm done. No, it's an interactive dance. As you discover that incongruous symptom and you on your fly, you recognize, this is a little bit yin deficiency. Okay, kidneys. Any low back soreness or pain, right? Any changes in the libido, right? So all of a sudden you're asking questions that may have absolutely nothing to do with a fatigue that they came in to see you with.
Yeah.
But by looking at their answers, you can now move forward into a proper diagnostic reasoning. When you do your final examinations, I'm not looking for diagnostic quips. Patient is kidney yang deficient. I'm looking for the reasoning. How did you arrive to kidney yang deficiency? Explain to me where your symptomatology is. Explain to me how you use your logic to arrive to that diagnosis. Because I'll tell you what, memorizing will get you to your midterms and to your multiple choice questions in many institutes out there. And then you go out into practice and you're scratching your head going, what was that? What am I supposed to do here? Right? I want you to walk out of here knowing that when you walk into a situation, whether it's a patient or sitting and having a coffee with your friend, just by observing, listening, being present there, and collecting the real-time information from that patient or from that friend or from your lover or whatever, you'll be able to immediately arrive at a logical reasoning for a diagnosis for what's bothering you. Giving you the tools. Okay.
On that, actually, sorry, since you mentioned it, libido was again one of my questions.
Yes.
I thought it was kidney yang deficiency, but I saw in my notes as well, and what you discussed in the classroom, that the kidney deficiency, so we have the hormonal imbalances and the low libido, shows that we have a deficiency of yin, kidney yin deficiency. So again, depending on the symptoms, in the flipped class, I put it in both sometimes because, you know, depending on the symptoms could be either or.
Yeah.
So.
Yeah, I'm going to ask you a hypothetical question.
Yeah.
Give me this difference of a low libido type in a kidney yin deficiency and a kidney yang deficiency. Patient comes to you and says, I have low libido. Is that, first of all, is that enough for you to say, okay, this is yin or yang deficiency?
Yeah, we have to see, the rest of the symptoms as well, the whole thing.
No, not even the rest of the symptoms. Just on the libido. What's the next question you want to ask them?
To see if they don't have mood at all, or if they have performance issues, or they try and not manage. So probably we have to see if it's kidneys or heart, or like if it's up or down. let's say.
Yeah,
What's
not only that, go back to yin and yang, go back to the root.
Yeah.
Is it a functional problem or is it a substance related problem?
Yeah.
Okay.
So
Functional
function has to
substance.
do with performance and substance has to do with the mood.
Desires, the moods,
Yeah.
right? The elements that are driving that, right?
Yeah.
Makes sense.
Good.
Yeah.
See, these are the reasonings that I want you to start thinking. I want you to open your minds to approaching these types of questions, not just superficially, but looking at it a little bit deeper to the next level, and then being able to reason them out and then justifying them. Because there are 4 stages in all diagnoses, right? And I've presented this 4-stage block: collection of data, assessment of data, hypothesis formation, and testing your hypothesis. That is the practice of medicine, whether it's TCM, Western medicine, chiropractic, I don't care. That's it. Those are the 4 stages of medicine. First, you collect the data. In Western medicine, it's x-rays, blood tests, et cetera, and chief complaint. In our situation, it's all of the elements of the tongue and the pulse and the questions and the symptoms and the patterns, etc. And then you put them all together and you assess them. Where things fit, where things don't fit, you come up with a reasoning to arrive at a hypothesis. And your hypothesis is the initial diagnosis that you're attributing to that patient's condition. And then you test your hypothesis. How do you test your hypothesis?
You go and treat the person. You have
exactly. That's why it's called a practice, right? I'm in private practice. That's why it's called a practice. You're testing your hypothesis. You assume, okay, it's a kidney insufficiency. Which points I'm going to use, which herbs I'm going to use. You assign that to the patient. You do the treatment. You send them home. When they come back next time, you go right back to 0 cycle. Collect the data, assess the data. Is my hypothesis correct? No? Okay, adjust the hypothesis, create a new approach, right? It's a cycle. It's an ever evolving cycle, right? So that's very important to understand. The fractals. Are you guys good with the fractals in understanding the microcosm with macrocosm?
Can I say something here? I got super excited when I saw fractals appearing as a topic because, yeah, that's a very physics concept in a way. That's where I learned it. And then, well, that really drove me crazy in a good manner. I was like, this is fantastic. I mean, and actually I shared that with some other friends and they were shocked on that. So nice.
I mean, you won't find this kind of lectures in any TCM school because we are an integrated school. Because we want to give you the knowledge and the skills and the education you need to survive and thrive in the modern integrative setting. You need to understand these concepts. Because guess what? You know, fractals are a physics concept and quantum elements and quantum mechanics, all of those concepts. There is a point, they're converging right now. And there's going to be a point where the ancient is going to converge with the modern. It's approaching faster than you think. Because as they discover more and more details into the quantum realm, they're finding more and more relativistic elements that are documented thousands of years ago in traditional medicines. So we're approaching that singularity, that connection. So having this exposure, understanding that the human body, from the cells to the body itself, to the organs, and to your systems, anatomical systems, are a microcosm of the macrocosm. And that will also give you a lot of diagnostic reasoning when you're looking at symptomatology. Always include the environment. Always pay attention to the patient's job, the patient's health, life, love life, professional life, travel life, all of that, it's all integrated, right? If someone comes to you and they've been living on the beachfront in some island and they are constantly bombarded with beach waves or beach wind, they're living in a windy condition. Their symptomatology will mimic wind. You will find signs and symptoms of wind internally. If they come to you from a very humid environment, very mucky environment, I guarantee you they're going to have bowel issues, digestive issues. Everything is going to be affecting them, right? Dry environment is going to symptomatically impact them as well. Personal life, if they're living in a constant state of sympathetic stimulation, fight and flight syndrome, whether it's because of personal relationships or business relationships or work environment, they're under constant yang stimulation. Sympathetic is yang, parasympathetic is yin, right? One heals and nurtures and relieves and recovers, parasympathetic, and then one is your fight and flight syndrome. That's your function to keep you alive, right? So if you're constantly under sympathetic nervous system stimulation, your epinephrine is high, your cortisol levels are high, your stress levels are high, your body is literally overdrive. And if you recall from your Foundations of Anatomy class, when I did talk about that, when you activate sympathetic nervous system, many internal organ systems shut down and functions shut down. You don't need them because evolutionarily that's designed to keep you alive. And so in doing that, you're literally shunting a lot of important homeostatic functions in your body so that you can survive, climb a tree, be safe from the lion that's chasing you or something, right? And then once you deactivate the sympathetic nervous system and then bring in the parasympathetic nervous system, the reverse occurs. It's cleanup time, it's recovery time, it's recuperation time, rest and relaxation, all of it. So pay attention to the fractal nature of the universe. In fact, one of the key slides that I always focus on is look at the yin and yang, you can look at the Zhang Fu differently. The star formation is inaccurate because in a star formation, the earth is not in the center. And we know that the earth, spleen, and stomach are in the central pivot. So when you see a shifting condition that is half in, half out, or not moving properly, or stuck in the middle, right? From a physiological or from a physical perspective, look at the spleen, stomach as potential blockages for that central activation. Just like liver and lung, qi, what are the directions of the spleen and stomach qi?
Sorry, Aram, what was the question? I was
just like I asked earlier, between the liver and the lung, and then their vector directions of the qi, what would be the same directional vector directions for the spleen stomach qi?
Spleen down and stomach. I know I'm doing it. Oops.
Yeah, you are doing it wrong. If stomach goes up, you're going to be vomiting all the time.
The other way around. Yes, spleen up, stomach down. Yes.
Stomach descends. Spleen ascends. Pure ascends. Turbid descends. So without that initial central function, guess what? When you superimpose that function of the Zhang Fu on top of the Tai Chi, the yin and yang, you can see how the transition element of the yin to yang is centered around the earth element. So even though many people consider in the 6 stages the center pivot stage as the liver and gallbladder, it is actually the spleen and the stomach that is the central pivot. Likewise, you can see just by transposing the 5 elements in the organ systems, you can clearly see that the liver, which is smack in the middle of the yin organ, right? This is the yin half of the Tai Chi, and it represents the seed of what?
The yang and the...
Exactly. So the liver is yang within yin. It is the function from the yin. And the converse of that, the lung is situated smack in the middle of the yang, and it is the most yin. That is why one of the statements of fact is that the lung is the most exterior Zang organ, the yin organ that is the most exterior, and therefore is susceptible to a lot of exogenous pathogenic invasions. Okay? So keep these interrelations in mind. You can see the north and south poles that represent fire and water. See, you can't see that in a classic depiction of the 5 elements. But in a fractal representation of the 5 elements, you can clearly see the homeostatic elements of water and fire in the north and south pole, and how fire, which represents your pituitary and your thymus and your thyroid, all of the hormonal elements that are up top, right? Hypophyseal elements of the anatomical or biomedical hormonal components, and then the kidneys, which represents the adrenals and the gonads, right? So all of your cyclic homeostatic mechanisms are basically described in this fractal nature. Okay? So, when you look at the foundations, where is that chart? One chart that I had right here. When you look at the foundational elements of yin and yang, right? Because under normal circumstances, yin and yang are balanced. But notice that in the Taiji, it's not a straight line. It's a curved line, the middle line, the S that separates the two, which means it's a dynamic relationship. It's never, you can never say, I have exactly 50% yin and exactly 50% yang. It's like quantum mechanics, right? You can know the location, not the direction or the speed, one or the other. You can't know both of them. As soon as you know one, the other one disappears. Same applies to yin and yang. You can't objectively measure them. But when you look at the dynamic balance of those yin and yang, a yang deficiency is still within the norm of that fluctuation where there's less yang. Conversely, yin deficiency is still within the norm where the yin is deficient. These are oftentimes transient states that can present with symptoms that are transient, meaning they're more acute, meaning they're new, they're not chronically set, right? And then the converse elements is where you get into the complex elements of true heat, false cold, or true cold, false heat. A lot of students are confused about these concepts. The best way to understand is that when you have true heat, because heat is the manifestation of functional hyperactivity, right? Anytime you rub something too fast, you're going to produce heat, right? So hyperactive functionality produces too much yang. And that too much yang is going to manifest in yang type symptoms: rising, uncontrollable, erratic, exogenous, exterior, upper part of the body, everything that's related to the yang part of the statements of fact. And when you have too much of that yang, it tends to overwhelm and either push the yin to the surface or compress it down into the lower part of the body. And this is how you end up with the complex conditions of left-right imbalance or exterior symptoms that are cold with an interior symptoms that are hot, right? So the cold has been pushed out to the hands and feet, cold hands and feet, but you have high fever, right? Or you have internal heat or symptoms of heat, severe diarrhea, burning diarrhea, right? So these are incongruent symptoms, but when you start putting them together and understanding how they can be classified or identified, that gives you a true understanding of what is true heat, false cold, and what is false heat, true cold. Okay. Is that clear?
Yeah.
Good. It's important. Always pay attention to the relationships of the yin and yang in the body. any disease. I don't care what Western disease is named. First of all, we don't look at Western diseases by name, right? You've learned that part. You look at the pattern differentiation. You look at the symptomatology that you've obtained from your patient, all inclusive. And then you make a determination of where the imbalance is. And at the root, always start with the yin and yang. Right? When you do your 8 differentiation diagnoses, right? What's the first one you do? Is this a yin or a yang? Is this a yin excess, yin deficiency, or yang excess, yang deficiency? Right? And then you go from there. Is this interior, exterior, right? So you have the opportunity now to begin at the root. And so I would look at reviewing all of the yin and yang associations. We know that up is yang, back is yang. We know that low is yang, inside and ventral part is yin, right? And lower part is yin. So pay attention to all of those. Right? If the patient comes down with you could have 2 exact patients with exact symptoms. One is on the lower part of the body, the other one is on the upper part of the body. And that alone could be a differentiating factor for you to determine whether it's a yang or a yin element. That's involved. Okay.
So in terms of treatment, we treat the root, or we treat first the symptom and then we go to the root. Like if the liver yang is rising, it's yin deficiency. So are we treating overall the yin deficiency, or we are going first to pacify a bit the liver yang, or I don't know, the symptoms of liver yang rising, and then go to the root?
Okay, I'm going to ask you a question to help you answer your own question.
Cool.
When you look at root and branch, what is excess, what is deficient? In general.
How do you mean?
Which one of these, branch or root, represents
I would
the
say
excess
that
element?
the root is the deficiency.
Good. You just answered your question. So what is the precept in TCM? First and foremost, treat the excess.
Yeah.
So a patient comes to you with a headache. If you try to tonify their head, to tonify them and balance them, etc., you're not addressing the headache. So first and foremost, address the branch, address your the presentation, the symptomatology. However, never ever neglect the root. And you combine both treatments together. You may do in combined therapies, for example, in the clinic, I will do tonification of the deficient through herbs and dietetics. And I will do
acupuncture for
expansion and clearing of the excess through acupuncture, manual therapies, things that are more functional, right? Acupuncture is more functional. Herbs are more substantive. So even in your own therapies, even in your own therapeutic approaches, you have a yin and a yang, right? So if you have a yin deficiency, you're going to go with a yin deficiency, right? You're going to not nurture them with a yin element. The yin element is dietetics, substantive stuff, right? Maybe herbal formulas, those types of things, medicines, etc. And then if you're going to clear the functional element, you're going to go with the functional therapeutics. Okay.
Okay. Yeah. Thank you.
Good. See, you answered your own question. Excellent. Good. Understanding also a very important concept that in the root, in the kidneys, the yin and yang are interchangeable, right? The relationship between yin and yang is the beginning of all of the functions in the body. Yin serves as the substance that is consumed, right, to produce all of the biological functions in your body. And that yin is consumed by the fire, the kidney yang. See, you have wood. Without wood, you can't boil this pot, okay? Wood becomes your kidney yin. The kidney yang burns that wood to produce the heat, the biological component of the energy, the kidney qi, the yuan qi, that is then spread across all of the sanjiao in different forms to provide physiological function in your body. Okay? So think of, at the root, think of these two things as interdependent. If you don't have fire, you can have all kinds of yin, but you don't have the fire. You can't burn the wood to produce the qi, right? Conversely, you know, if you have too much fire and not enough wood, the fire is going to burn the wood, and then it's going to, what happens with the fire when it finishes the wood, burning the wood?
It's off.
It goes out.
Yeah.
Perfect example of the interdependency of the yin and the yang. If the kidney yang is too excess and starts consuming the yin, yin becomes deficient. After a certain point, there's not enough yin for the kidney to burn, and therefore the kidney, the yang to burn, therefore the yang becomes deficient. I hope you understand the concept. It's a very involved concept, but it's very important to understand. Okay. So when you go back and look at all of these case studies, I chose some of these case studies specifically because they contain both yin and yang deficiency symptoms. Okay. And by understanding how they fit together, by using your logic in terms of, okay, this is yin deficiency, and this is yang deficiency. Now, how do I fit these yang deficiencies in this concept? Is it because I have too much of a yin deficiency, that's why the yang is deficient? Or did it start with a yang deficiency and progressed into yin deficiency? And looking at the overall presentation and the holistic nature of the patient, you'll be able to pick that up. If I have a robust young individual, a big bulky male who's suffering from yin deficiency symptoms, low libido, you know, nighttime fatigue, etc.,
You have problem.
exactly, right? It doesn't fit, right? So I'm going to rely more heavily on where is the yin deficiency, because I don't see a yang deficiency. I may see one or two symptoms that may look like yang deficiency, but now I need, because I look at the constitution of the individual, and this is a yang individual, I need to figure out how that yang deficiency fits in here with a premise of yin deficiency. Where's the connection, right? And oftentimes that's what leads you to the pinpoint accurate diagnosis of the underlying condition. Okay. Do I have any other questions so far? Let me see. Was there anything else I wanted to share with you about today? Over the kidneys. You have these, right? They were posted on your classroom.
Yes.
You have access to them. Good. I only ask that you don't share outside. You can show that you show it, but don't distribute it, please. Okay. This is important. The cyclical nature, right? I mentioned that the yin and yang, the curved line in the middle, is important to identify that these yin and yang transitions are not binary. They are cyclical. Everything in the universe is cyclical. Everything, literally, 2 sine theta over negative pi is the foundations of reality. I swear. As physics gets more and more deeper into understanding life, consciousness, existence, all of that, it all comes down to this. It's a balance between entropy and life, between the everlasting dance between chaos and creation. And that is represented solely in the internal Taiji 2. When you apply that to your internal organs, you begin to understand how and why certain symptoms appear. For example, as the liver wood yin transitions into the yang of the lung from the yang within yin into the yin within yang, right? This is where you're running into a lot of asthma conditions. Most asthmatics will pop open, wake up, and open their eyes at 3 a.m. in the morning with cough and with shortness of breath. Because at this time, the transition time is the liver. If the liver is exogenous, it's too much energy, it's going to overwhelm the yin within yang. Right? And so this transition of all of these organs and the energetic pathways from both the clock. Another thing that this is important for you in understanding is yang, yin, transition points. Face is where all the yang collects. Chest is where all the yin collects. Hands and feet, yin to yang to yin. That is where exchanges occur. So symptomatologically, if you look at a patient and they're complaining most of their symptoms in their face or in the upper part of the body, it's more yang. If they're complaining of things that are happening in the hands and feet, this is more transition-related elements. Right? Even from a therapeutics approach, understanding the clocks, the circadian rhythm, and when to treat. If you have an excess in your tai yang, in your small intestine or bladder channel, because this is a yang time, schedule your patients at that time and drain using acupuncture the functional yang at that time, because it's at peak. You can affect more change at that time. Schedule your tonification in the yin time, because the yin time is weak. If you have yin deficiency, that's when you focus on the yin, right? Okay.
May I ask just a practical question? I see you have notes underneath. Those notes are for you, or they are for...
These notes are for me.
Okay,
sorry.
cool.
Yeah, these are my notes. And,
No, that's fine. That's fine. I didn't know if they were just for the lecture or if they are part of your notes. That's why I'm asking.
Most of that stuff is actually covered in the lecture. So when you hear my recording, most of that stuff is the stuff I'm talking.
Yeah. I'm sure about it. It was just practical. That's why I asked, because I noticed it.
Ideal time to sleep, guys.
Yeah.
2100 to 3:03 a.m. Ideal. Now, given most of our lifetime and most of our life commitments, waking up at 3 a.m. is kind of weird, But so is going to bed.
Okay.
Yeah, but so is going to bed at 9, right?
Right.
But is 6 hours enough?
Yeah.
Okay.
Biomedically speaking, depending on age, as we mature, 6 to 7 hours is more than enough for people over 40, 50. Younger individuals who are in their teens may require a little bit more, maybe 7 to 8 hours.
Yeah.
Okay. Why is the 8 hours then? It seems to be, the magic. I don't know. I mean, yeah, that's okay.
It's convenient. That's why.
Right. Okay.
Yeah, they said
because it
8
gets
hours
darker
work,
and then
8 hours
exactly.
Entertain yourself, and 8 hours sleep.
8 hours of slavery, 8 hours of presumed fun, and 8 hours of I don't want to live anymore. Right. So again, welcome to your internal medicine class. You'll be exposed to many, many wonderful topics. We have, I think, B syndrome coming up next week, or painful obstruction, and you'll have an opportunity to look at more specifically in terms of symptomatology and differentiation. All I can tell you is, if you take absolutely nothing from this week's lecture, take this one fact: everything begins with yin and yang. That's it. And that taiji, that yin and yang symbol, is not just a tattoo that looks cool on somebody's back, or a design element that you can integrate into your logo. It is the key to reality. It is the key to explain everything. I mean, you can ask me a question about anything from existence to mundane questions, and I'll bring the Taiji in and I'll be able to explain it 100%. So internalize that as best as you can in your concepts, in your understanding of reality, life, health, disease, all of it. Okay. All right. Thank you very much. And I look forward to working with you guys. Okay.
Thank you.
Thank you, Adam.
Take
It's
care.
great.
All right.
Have a good weekend. Bye-bye.
Bye. Bye.